So welcome everyone from wherever you're calling in today. Good morning, good afternoon. This is Patients for Patient Safety Canada Pressure Injuries Learning Series, Session 2, Prevention and Resources. So I'm Kathy Kovacs-Burns. I am co-chair and co-founder for Patients for Patient Safety Canada, and I will be your moderator for today's session. I reside in Edmonton, Alberta, which is located on the traditional meeting place and home for many Indigenous peoples identified in Treaty 6 and Métis Region 2 and 4 territory. So I welcome all of you to introduce yourself in the chat and to tell us where you are calling in from. I also welcome you to put your questions and comments in the chat, and we will pick that up when we come to the end of the session for the question and answer session. So this pressure injury learning series is hosted by Patients Patient Safety Canada as part of Canadian Patient Safety Week this week, the theme of which is small changes, big impact, and safer care. Patients Patient Safety Canada is the voice of patients, caregivers, and families who bring our healthcare experiences, including of harm that we have experienced, to help improve safety at all levels of healthcare systems across Canada. Our vision is every patient safe. Our unique and valuable perspective complements those of care providers, health leaders, policymakers, and managers of healthcare organizations. And by working in partnership, we help ensure that patient safety decisions and initiatives are truly patient or person-centered and result in safe care. Given that nationally in 2022 and 23, patient pressure injuries are identified as one of the top categories of harmful events in Canada, our Patients for Patient Safety Canada members felt that there was a need to actually host this learning series. In session 1 of this series, we shared our experiences and raised awareness about the importance of pressure injuries. Members of our group, including myself, shared some of our stories in that first session. In the second session today, our goal is to inform and share resources to help empower patients, families, and caregivers and care providers to prevent and manage pressure injuries. As we wish to be inclusive and reach as many people as possible, we have made the recordings of both of these sessions available, and we ask that you actually help to raise the awareness and distribute these through your network. The link for this Google slide presentation will be available in the chat, should be there now. And at the end of the presentation today, you will be able to then go in and look at some web links. We will talk about those as we go through the presentation. So that the presentation should be underlined in the chat, but also through the presentation, you will see that we have underlined resources that you can reference. So we prepared this session with supports and resources from many sources, including Wounds Canada, and individuals are here present today to answer questions. The Registered Nurses Association of Ontario, and other credible sources as well. So now, without further ado, I'm going to invite and introduce our speaker today, Andrea. So Andrea Cole-Haskane is a registered nurse and a practice lead for neurosciences rehabilitation and vision strategic clinical network within Alberta Health Services. More specifically, she is leading a provincial pressure injury prevention initiative for adult patients in hospital. Much of her career included working as a clinical nurse educator while in hospital. She is currently taking her Master's of Nursing with the University of Calgary and holds graduate certificates in Leadership for Health System Transformation and Contemporary Topics in Aging, and is a ProSci certified change practitioner. More specifically and personally, she's a caregiver of her mom who has been dealing with pressure injuries and is committed to focusing on pressure injuries or preventing pressure injuries. So Andrea, I'm going to turn it over to you. And thank you for being with us today.
Thank you very much. And thank you for moving the slides for me. In this session, we wish to share information and skills about how to prevent pressure injuries and support our loved ones if they're at risk. Be on the lookout for good tips throughout the presentation. We aim to empower and support you to supplement care for vulnerable patients to help reduce suffering and save lives. Today is about people helping people, patients helping patients. It's sad that many families state they wish they would have known about the risks. It's time to ensure that pressure injury prevention becomes a critical component of all aspects of safe patient care. Prevention is key because we know that 70% of pressure injuries are preventable. Next slide, please. Pressure injuries or ulcers are also formally known as bed sores, and they can be very serious and life-threatening. Today, we'll be learning about how to prevent or manage them. While we may not be able to prevent all pressure injuries, we can work toward the goal of minimizing harm. How do we participate in this important work? The first thing we need to do is a risk assessment. By identifying patients at risk, we can take action to minimize harm. There are main contributing factors that increase the risk and can cause problems. They are moisture, diminished sensation and pressure, friction, and or shear. If you see these main factors, a warning light should go on in your head to consider that pressure injuries may already be occurring. Moisture, this can be from incontinence, from urine, feces, sweat, drool, wet wounds, and the limited ability to manage your own hygiene. A tip is to keep the skin clean and dry and educate the patient to notify if they're wet. Diminished sensation can be caused from a number of conditions such as stroke, paralysis, diabetes, or cancer. A tip is to remove the pressure to the areas with limited feeling for patients with diminished sensation. Pressure, friction, and shear. So sitting or lying in one position for too long creates pressure, and shear happens when the body is sliding down or moving against an unmoving object. And friction happens when two surfaces rub against each other, like when you rub your hands together. A tip is to reposition every 2 to 4 hours in bed or every 15 minutes while sitting, with care not to tear or stretch the skin. Please remember that these recommendations are general guidelines and may not be specifically applied to your particular circumstances. Please refer to your healthcare provider for specific recommendations and educate the patient to self-reposition if possible. So next slide, please. As you can see, there are many other factors that increase the risk of skin breakdown. Other factors include medical conditions, impaired oxygenation, medical treatments or devices, end-of-life lifestyle factors, medical history, extremes of age, impaired activity or mobility, and impaired nutrition. While the main contributing factors are moisture, diminished sensation, and pressure, friction, and shear, there's no one single risk factor, but a complicated interplay of factors that can result in a pressure injury. For example, special attention may be needed for patients who are underweight, as they may not have enough protection over bony prominences, or for patients who are very large because they may have increased pressure on their tissues. They may not be active or unable to change positions easily. Their skin folds may have a moist environment which promotes skin breakdown or infection that may have and they may have poor nutrition even though they have excess body fat. So next slide, please. Nutrition is very important to keep the skin healthy. Your body has important work to heal wounds, and eating a well-balanced diet is key. Barriers of accessing quality nutritious foods to vulnerable people needs action. Access to nutritious foods is healthy inequity for some Canadians. A good tip is an important job for families of loved ones in hospital or long-term care is to check with the medical team or see if they can bring their own healthy foods from home or restaurants that patients are comfortable with and can supplement their nutrition when they get tired of hospital food and don't want to eat. As well, if you're concerned or you'd like more information, please ask for a referral to a dietitian who can offer many options to increase nutrition. Next slide. Tips on how to prevent or treat pressure injuries. Start by understanding the daily care routine and when skin checks are being done. Best practice suggests develop a pressure injury plan of care that incorporates goals mutually agreed upon by the person's circle of care, and the interprofessional team. As a caregiver, it's good to be aware that if you notice redness to an open area, especially around bony areas or skin rubs on skin or around medical devices, bring this to the attention of the healthcare provider. Monitor for incontinence. Moisture breaks down skin faster. We need to be sensitive to the dignity and privacy of the patient, and this has to be their preference. As well, caregivers need to be sensitive to the operations of the long-term care facility and hospital and partner with the professions there. Bridging these challenges is tricky. Understand that the patient can change positions, or understand if the patient can change positions. It's critically important to change positions about every 2 to 4 hours when lying down, every 15 to 30 minutes while sitting. This helps pressure injuries heal and lowers the chance of getting new pressure injuries. Try setting a timer to remind yourself or ask the care team if there is a turning schedule. If you see redness over bony areas, turn or shift weight more often. It's critically important to educate the patient about the danger of pressure injuries and encourage the patient to mobilize often. As well, if you know what caused the pressure injury, find a way to remove that pressure or cause. Make sure the patient is not sitting or lying on hard objects or surfaces. Use pillows to assist with proper positioning to offload pressure areas. Limit the head of the bed elevation to less than 30 degrees if the medical condition permits. Encourage eating a wide diversity of healthy foods first and drink plenty of fluids. Another tip is to ask for referrals from doctors or nurses to prevent pressure injuries. A physiotherapist can help strengthen and rehabilitate the patient. An occupational therapist can assist with adapted skills and equipment such as air mattresses with alternating pressure, which can be very helpful. As well, they're a wonderful source of information for techniques to turn the patient without injuring the patient or caregiver. If a wound has occurred, ask for a referral to a wound care nurse or clinic. If you're providing care at home, ask for guidance on how to use protective dressings, heel protectors, or lotions as directed by your healthcare provider. Wash pressure injuries as often as your doctor or healthcare team recommends. Most tap water is safe, but follow the advice of your doctor or nurse. Put on bandages as your healthcare provider suggests. Next slide, please. There are other more advanced therapies that may be effective to promote closure of healable pressure injuries. They include electrical stimulation, UV light, ultrasound, and negative pressure wound therapy. Negative pressure therapy is a clean, sealed, gentle vacuum that stimulates the tissues to heal. It removes excess fluid, helps lower the amount of bacteria, and encourages the cells to grow and create more tissue. A tip is to have a referral to a wound care nurse or clinic that may be needed to access this therapy. Please keep in mind that some patients may not benefit from this therapy, and to discuss options with your healthcare provider. We will discuss aligning care with the patient's and family's goals in the next slide. Preventing or healing a pressure injury may be improbable, and these wounds may be classified as non-healing or non-healable. A goal of wound closure may not be realistic when factors that impair wound healing are present, such as poor blood supply, malnutrition, cancer, unmanageable complications, and or if the patient doesn't follow the plan of care. Comfort can be most important for some patients, and turning patients may be very painful, interrupt their sleep, or upsetting to them, such as when patients are dying and less aware of things. Goals should always be patient centered and culturally sensitive. Care providers should strive to keep the patient's needs and perspectives at the heart of the healthcare encounter, contributing in a way that tries to prioritize the needs of the patient. All patients have their own particular contexts and social relationships that may impact how to best interpret their preferences and well being. Healthcare providers need to respect the informed voluntary wishes of patients. Any decisions need to be mutually agreed upon by the patient and their circle of care, and collaboration is key. In the next slide, we'll show some examples of real wounds, so please take cautions for sensitive viewers. Information sharing and meaningful engagement is important to us. When healthcare providers describe wounds, it can be difficult to understand. In order to improve collaboration, we'd like to show you what wounds can look like and define some wound terminology. Granulation tissue is healthy red or pink tissue that needs to be kept clean and protected for optimal wound healing. Slough is like a moist scab that can have a lot of bacteria. It's good to seek care to have this removed, as it can be a source of infection. Avascular means it is not connected to the blood supply and can cause tissue death. Exudate is the fluid oozing from wounds. Necrotic or eschar is dried skin, like a hard scab, that can be protective to the tissue underneath. Depending on the goals and the condition of the patient, it can be left in place as protective covering and must be kept dry. Otherwise, if it is removed, it is called debridement. A tip for families and caregivers: with the patient's permission, it may be helpful to have close-up pictures of the wound to compare if there are any changes, or you can also ask the facility if they can aid in this documentation. Next slide. Wounds can develop quickly, and it is best not to delay care. Open wounds can be a source of infection as well. If the infection moves from the wound into the bloodstream, this is called sepsis. The patient's health may change at any time, and caregivers should remain vigilant for changes and seek immediate help if they notice any of the following: increased pain, swelling, warmth, or redness, red streaks from the wound or worsening appearance, new or change in the pus drainage from the wound, a fever or chills, any new confusion, delirium, or tiredness. Seek help as well if there are new or increasing pressure injuries, or if the patient needs more help or help changing position in bed or in a chair. Your voice is very important. Please advocate and keep the care team in touch with your concerns. Call your local health link or have a physician or nurse look at the wound as soon as possible. Over a period of 3 years, Yvonne's mother-in-law lived with ALS. Yvonne reflects on some of the challenges of preventing pressure injuries while supporting the care of Annette living at home. This is Yvonne's story.
When I think of pressure injuries, I think of my mother-in-law, Annette, who was diagnosed with ALS. This disease caused her to slowly lose her muscle power until she was paralyzed. I remember fondly the ALS Ice Bucket Challenge, and it seemed the whole world rallied around us, and it meant so much. That was really super awesome. Annette was a nurse and understood the importance of repositioning and always being vigilant to prevent pressure wounds. We were well informed about the risks. Supporting Annette while living with ALS was about adapting and learning how to manage the challenges. We had so much wonderful guidance from healthcare professionals so that she could continue to work with her strengths, maximize her independence, and continue to live at home, which was her preference. I'd like to ask your patience as I touch on the two main challenges we experienced caring for pressure injuries at home: financial strain and burnout. Our healthcare system doesn't pay for around-the-clock healthcare workers for home use. And Annette spent most of her savings on hiring healthcare aides and buying equipment and supplies. Please understand, caring for someone paralyzed at home can be expensive and around-the-clock care. For example, when the healthcare aide went home in the evening, Annette's husband would get up in the night as often as every 2 hours to reposition her to prevent pressure injuries until the morning shift started. The guidelines were to reposition every 2 hours, and this is what we did. Unfortunately, this and other factors led to caregiver burnout. Burnout is when you just can't take it anymore, and you become numb and angry with everything. You lose your humanity, and you just don't care. While there was a strong focus on supporting Annette, there was virtually no support and understanding for what the caregivers were going through. We were successful in preventing serious pressure injuries, and Annette had a good quality of life and was able to stay home for the 3 years until she passed away. The support from the ALS Ice Bucket Challenge was truly wonderful, and it gave her the strength to live her life on her own terms. She felt her life and her voice were important. Overall, everything went as planned, and there were only a few bumps in the road. It all took a team working together.
Thank you, Yvonne. In the next part of this presentation, we'd like to give a look at some very useful resources for patients, caregivers, friends, and families. We'd like to introduce some free learning modules to help guide care. The first one is a caregiver series created by Canadian Virtual Hospice that's designed for those who are looking after someone who is ill at home. Caregiving can be challenging and lead to burnout. We hope that this resource might provide support during this challenging time. These modules include supports for diagnosis and reactions, communication and conversations, preparing for caregiving at home, looking after you, about medications, hands-on care, recognizing symptoms, and providing comfort and care when death is near and after a death has occurred. Next slide. The information presented in these presentations is supported by a great body of knowledge supported by research. These references are from trusted and respected organizations. We have a mixture of resources for patients, caregivers, and healthcare providers, and we'd like to further describe them here so you can explore for yourself. As we have only briefly touched the surface, we recommend that you explore to find that there is much more information and good supports available. An excellent reference for caregivers is Wounds Canada, which has a Care at Home series, caring for pressure injuries at home. As well, they have best practice recommendations for the prevention and management of pressure injuries. Wounds Canada is a great starting point to explore further. Crystal from Wounds Canada is with us today, and if anyone has any questions about the Wounds Canada resources, Crystal is on the line, and we have time at the end of the presentation to answer your questions today. But feel free to post in the chat box, and then we'll address them at the end. Healthcare Excellence Canada is another great resource to support caregivers with a focus on patient safety and harm. They have information on a diverse range of subjects, including pressure injuries and how to support safety conversations. Safety conversations allow you to gain more information about any aspect of care. Those who ask questions and take an active role in their health care seek greater improvement in their health and than those who don't. It's important to feel comfortable to talk about safety. You could say, I'm concerned about my loved one's risk of pressure injuries. Then listen and ask healthcare providers to work with you or provide more information or outline specific steps and keep you in touch with the care plans. We'd like to pause here and emphasize the patient's voice. Patients need a safe place so that they can feel comfortable to speak up when they notice something or be open to thinking about allowing skin checks. This goes hand in hand with feeling they are important and their needs are important. As well, they need to understand the importance of pain and life-threatening risks of pressure injuries and that their privacy is important and they are respected. Asking for help is never, ever a sign of weakness. There's learning modules from Living My Culture. Living My Culture can help support and empower people of various cultures. People of various cultures share their stories and wisdom about living with serious illness, end of life, and grief support to others. Some cultures are represented are First Nations, Injuriy, Métis, Chinese, Ethiopian, Filipino, Indian, Iranian, Italian, Pakistani, and Somali. There's a great video. We're not going to show it today, but we recommend you watching it. It's Dispelling Common Myths About Pressure Injuries. It's available on YouTube. In this brief video, Julie from Alberta Health Service highlights 6 common myths about hospital-acquired pressure injuries. She helps us understand what pressure injuries are and why patients are at risk. Julie also introduces the bundle of interventions, which we call Skin Plus, that you'll see on the next slide, that Alberta Health Services and Covenant Health have adopted to help keep patients safe and prevent pressure injuries while they are in hospital. So Skin Plus is an acronym for both patients and healthcare providers to remember important aspects of pressure injury prevention. In brief, inspect the skin, make sure the person has the right support surface, keep moving, protect the skin from any incontinence or moisture, ensure they are on a healthy diet with optimized nutrition, engage with others, and use a risk assessment tool to assess the patient if there is a likelihood of developing pressure injuries. There are over 70 recommendations. Next slide, please. In this quick reference guide developed by the European Pressure Ulcer Advisory Panel, the National Pressure Injury Advisory Panel, and the Pan-Pacific Pressure Injury Alliance. It is based on the best available evidence from research studies. Recommendations are evidence-based to assist health professionals, patient consumers, and informal caregivers to make decisions about appropriate health care for specific clinical conditions. For an example, on the topic of repositioning, they recommend to reposition all individuals with or at risk of pressure injuries on an individualized schedule, which considers the individual's level of activity, mobility, and ability to independently reposition, skin and tissue tolerance, general medical condition, goals, comfort, and pain. The next resource is from Alberta Health and contains many links about pressure injuries such as condition, basics, prevention, when to call a doctor, treatments, self-care, etc. The Registered Nurses Association of Ontario has produced two best practice guidelines on pressure injuries. First is assessment and management of pressure injuries for the interprofessional team, which has been published in 2017, and the risk assessment and prevention of pressure ulcers, which was published in 2011. The RNAO team is currently working on combining these guidelines into a new updated guideline that will be published in 2024. Further information about this new guideline can be found on their website, in progress guidelines/rnao.ca. This new guideline will provide evidence-based guidance for nurses and members of the interprofessional team who provide care to people at risk of developing pressure injuries and those with existing pressure injuries. A Cochrane review is a systematic way of taking the body of scientific knowledge about a question. It brings it all together to understand all the evidence and make recommendations. It is regarded as the highest level of scientific evidence because it involves gathering knowledge from many scientific studies or research papers, which has been gathered from many thousands of patients. In brief, they report there is no clear evidence regarding with particular positions and repositioning schedule are the most effective for preventing pressure injuries in adults. The situation may be individualized and complex. They state that it's important to minimize the risk of oxygen deprivation and nutrients that are required for healthy tissue, and this should be balanced with negative effects of repositioning, such as the potential for sleep disruption, heightened increases in patient pain perception, and for caregivers, musculoskeletal injuries. Further research is needed. This editorial, published in the Journal of Wound Care Management and Prevention, discusses the special concerns of increasing diversity, equity, and inclusion in wound care and pressure injuries. To support professional caregivers, there's learning modules from the Canadian Patient Safety Institute, which can provide training on how to engage and collaborate with patients and families. From caregiver.ca, there are several learning modules to help professionals engage with patients' families. Some of the modules are recognizing the caregiver role, communicating with family caregivers, partnering with family caregivers, fostering resilience in family caregivers, navigating health and social systems, and accessing resources and enhancing the culture and context of care. Pressure injury prevention is a required organizational practice from Accreditation Canada across all healthcare settings in hospital, supported living, and long-term care. There are standards of tests of compliance that are areas that are required to meet to achieve accreditation status. And I'll hand it back over to Kathy.
Thank you, Andrea, very much for the presentation and the valuable information. So the next few slides are actually those that you can actually go to look up links that's related to each one of the slides and the resources that are provided. So we've included them here, and you certainly can look at those at your convenience. We've also included at the end the recordings and access to those recordings. There is a blog actually happening as well, working together to improve patient safety, that came out of the World Patient Safety Day, but continuing. And so those links will be available to you as well. Now, what I'd like to do actually is to thank a number of people for the presentation and coordination. There are for sure Andrea for presenting today, all of the volunteers who shared their stories and their experiences, and who volunteered to be part of the production of the series. I'd also like to extend my acknowledgement and thanks to the working group involved in this, and they are part of this call as well. So Teresa Malloy Miller, Crystal McCallum, Genevieve Verity, Marianne Darpino, Kim Newdorf, and Janet Bradshaw. As I mentioned, I'd like to thank all the volunteers involved. We hope that the stories and the information resonates with you and that you are able to connect and understand what the impact of pressure injuries might be for you or your loved ones or others that you might be affiliated with or associated with in terms of your work environment or other situations. So we hope that you will work together with us to create the improvements in patient safety and prevent the pressure injuries. Oops, let me just go back. So we do have a call to action that we put out for you. First of all, for patients, families, and caregivers, we'd like you to become aware about the risks and skills to prevent, manage pressure injuries, to increase your awareness of contacts and resources that are available to help you through any kinds of questions you might have, and notice what is happening and gather that information. Get involved and act quickly in prevention and management of pressure injuries. Advocate and share your voice to bring your concerns to the attention of healthcare providers. Seek supports where you need it and build resilience to prevent burnout. For healthcare providers, we ask that you proactively prevent and manage pressure injuries. Prevention results in lives saved and a reduction of suffering and harm. 70% of pressure injuries are preventable, and so prevention really is the key. Lead the care and take ownership of problems. Collaborate with interprofessionals to reduce the gaps in healthcare. Promote consistent action with appropriate assessments and quick follow through with treatments or corrective actions. Educate and coach and work with patients, family, and caregivers to learn the risks and participate in care. They are a valuable member of the team, and focusing on patient-centered, culturally sensitive care is also sensitive to the social determinants of health and working towards the reduction of health inequities. This includes increased empowerment of the patient, caregiver, and family's voice. And finally, a note that stage 3 and 4 pressure injuries are recognized as never events. Never events are those patient safety incidents that result in serious patient harm or death, and that can be prevented by using organizational checks and balances. And that includes everyone taking some responsibility and being proactive. There is a link that we would provide for this, so you can actually look up the never events for hospital care in Canada. So now it's time for you to be participating. We would love to hear from you, so you can actually unmute. We have about 40 minutes or so to hear from you, comments or questions, what resonated with you about pressure injury prevention and care, and any questions or comments that you'd like to share with us. So please, participate in the chat. We're going to bring forward some of those comments as well. I don't know if we're able to do that. Oh, I see a hand going up. Donna, do you want to just unmute yourself?
Yeah, I think I did, Kathy.
Okay.
You can hear me? Yeah.
Yes.
I did mention in the chat, but what really resonated with me was the fact that there is a caregivers resource, which is huge. When our daughter, who has spina bifida, was at home, there were no resources whatsoever for caregivers. And, I think having those resources, and I'm sure in it says, I haven't read it myself, but just seeing it is wonderful. I'm sure it probably said it's okay to ask for help. But as young parents, we didn't think we could ask for help. We felt guilty if we would ever have asked for help. I'm much older and wiser now. And I guess my message to any young people out there, or anyone who is looking after someone at home, don't be afraid to ask for help. It's better for the patient or the person, your loved one you're looking after, and better for you. So I think it's wonderful that there's the caregiver guide, and I'm really, really thrilled to see that.
Thank you so much, Donna, for sharing that with us. Very valuable. Good tip. Anyone else? Maybe we could go to the chat. Is there Yvonne or can you tell us if I can't see the chat myself right now.
Yeah, I saw lots of people are sharing links. So I see Crystal is here as well with us, and she's shared a whole bunch of links about Wounds Canada resources and best practice recommendations. I was wondering if Crystal, you'd like to introduce some of the things you introduced in the chat with us?
Crystal, are you able to come off mute? Want to comment on a
Oh, can you hear me
resources?
now?
Yeah,
Yes,
there we
thank
go.
you. Yeah.
Sorry about that. Yeah, so there are a number of resources for people with and at risk for wounds and for healthcare professionals at Wounds Canada. The vast majority of the resources we've created and educational programs we have are free. So we certainly encourage individuals to leverage them. There is a Care at Home series of documents that provides some advice and general tips on how to manage a pressure injury and prevent a pressure injury should they occur for lay people. There is also a series called the DIY series, which builds on that document and provides some further tips and advice on pressure injury prevention and management. We also have a number of clinician-focused resources that you may find helpful, our best practice recommendation documents and product pickers. So there's one there to help you choose the most appropriate therapeutic surface for an individual. There are also educational programming and continuing education events that you may want to consider taking advantage of, both through the Wounds Canada Institute and through our annual Pressure Injury Symposium, which is coming up on November 16th. And it's virtual, so you can join from anywhere in the world. I see we have some international folks on the line, so you can consider joining too.
Excellent. Thank you, Crystal. So just a quick question in terms of are you able to tell us if there's any, are all these resources used quite extensively? Have you noticed people pulling the resources out, utilizing them? Have they been used in a wide variety of settings by a wide variety of groups?
Yes, so our most popular resource from a clinician perspective would be our best practice recommendation documents. They're currently under review, so a new version of these is going to be published in 2023 and 2024. They are updated every 4 years to make sure they reflect the most current evidence. From a patient's perspective, our Care at Home series documents is our most widely downloaded. The series is available currently in both English and French language, and they were created in response to health human resource limitations that were experienced and we still continue to experience with COVID-19. So more people were managing their wounds at home with less healthcare supports, and these documents were created to help support those individuals.
Excellent. Thanks very much. So Nazareth, I saw that your hand was up earlier. I apologize. Please go ahead.
Can you hear me?
Yes.
Okay, great. Yes, hi, thank you for having this. It's amazing. I'm a full-time caregiver to, an 80-some-year-old, patient with dementia. Home care provides support with us, and it's much appreciated. But when wound care started, I felt very overwhelmed. And I did reach out, and, the wound care staff came in, home care staff came in and supported us at the beginning, and the wound healed, in one area, and then, but now it came back. So I heard you guys say something about a clinic and a referral that could be happening that could support us on a continuing basis. And, so how do we get a referral to this clinic? And I'm just wondering, how come they didn't, like the home care people, how come they didn't tell us, okay, if it comes back, this is what needs to happen, like we needed some kind of plan to kind of prevent this from happening again, or from like, now I feel unsupported and I feel overwhelmed again. And so how do we make this referral happen?
So thank you for sharing that and your question. Andrea, can I maybe ask you to respond to that question about the wounds clinic?
Sure. And Nazareth, where are you located?
I'm in Edmonton, Alberta.
Oh, okay, because there are on Alberta Health Service website, there are some information that you should be able to access, but best would be go to the physician that's caring for the patient that you're dealing with and ask for a referral. But you should be able to also, within Alberta Health Services on the external website, search for that information, but your healthcare provider should be able to put in a referral. And I'm in Calgary. I know we have outpatient clinics here, and they do have outpatient clinics in Edmonton as well.
That's correct.
So
I'm in
clinic,
Edmonton as well, so I can confirm that. Yeah.
and the only way you can access this clinic is by referral. You cannot go just in there as a patient or a caregiver. No.
I'm pretty sure you need a referral from
Correct.
clinic. Yeah.
It doesn't have to necessarily be your doctor.
Mhm.
As in my family's case, it was a nurse practitioner. So any healthcare provider that is caring for your loved one should be able to start that process for the referral.
And how long does it take to get access to those clinics?
That I can't answer. Andrea, do you know? I mean, it
Yeah,
happened pretty fast for my father. He was able to get in because it was seen to be pretty urgent, and so they do triage very quickly. But that's my experience.
and you could reach out to your home care case manager as well, and they might even be able to put that referral in for you and expedite it.
Okay, great. Thank you.
Good luck with that. Thank you. So I see Iwana. Go ahead. I see your hand up.
Hi, everyone. I just wanted to say thank you to everyone who put this conversation together. I am a former nurse. I'm a patient safety and patient engagement specialist, and currently I'm just a citizen. But I practice in Romania and worked in patient safety here in Canada. And it's striking in a way and uniting in a strange and awkward way that we are suffering the same problem all over the world. So seeing this international community come together and uniting forces is quite important. I like that the presentation focused on both what healthcare workers can do and what patients can do. Recently, an uncle of mine in Romania, his wife was very, very ill and bedridden. And my mom, also a former nurse, would go and tell them, be aware of bed sores. That's the biggest problem. That's the biggest risk we have now, and encourage and educate them to prevent the bed sore. But without my mom being there with his brother and teaching them all the time about bed sores, it would have been inevitable. So putting the tools in the hands of the healthcare workers who can make the referral, just like we just talked now in a very specific case. But also on the other side, finding a way to reach the patients and families, like my uncle. Like, he was in a rural area, low middle class, not very educated around healthcare and websites and issues. How do we make sure that people like my uncle have the support they need? And just like Donna said, he would probably be embarrassed and ashamed to ask for help, especially a man. So you can imagine how fragile this situation is. And it's all over the world. Like we can see rural Canada being in a very situation like my uncle. So I'm grateful we are having this conversation. I am committed to now look for information in Romanian and see if there can be something that can be disseminated to both healthcare workers and providers. Because if we focus on this together, we can make a big impact on safety. So thank you for this session.
Thanks very much, Irwana, for sharing that and suggestions. Thank you. Anyone else? I don't see anything in the chat box, so I'm looking to
Kim had her hand up earlier,
Kim.
but she put it down.
Kim, where are you? I don't. Oh, there you are. Go ahead.
Oh, okay. Well, I think my comments are very much along the line of what other people have been saying, and that it is one of the strengths, I think, is bringing caregivers and family members and patients together. And that needs to come even tighter together. One of the things that I think is still a barrier, and I've mentioned this before, is that these pressure injuries often happen in very intimate areas of the body. And so while it may be easier for a parent to look at a child's skin, it's not as easy to overcome that cultural gap or traditional way of interacting with a child looking at a parent, or not a child, but an adult child, family member looking at a parent's wound, potential for wounds. So I think, there still can be guidance with healthcare professionals and family members to bridge that. The conversations need to happen in terms of advanced directives so that patients are comfortable with family members having a peek and checking on the skin. And then if healthcare professionals as well can guide discreetly, talk about confidentiality, so that it's a very respectful kind of an interaction to make everybody comfortable doing these very intimate types of assessments. Those are my comments. Thank you. Thank you for this presentation.
Yeah, thanks very much, Kim. So I share with that because my father was, in terms of pressure injuries, he was the one we were caring for, and it was difficult. It's very challenging, as you say. And so I do think, that one of the things we had to start with was the safe conversations of why it's important for us to actually care, and to have a look at what's going on with his skin and to make sure that he wasn't going to be suffering with pain or anything else, right? And so having those conversations can be delicate. So I really appreciate that comment. And it's important to start that, and including with the healthcare providers, so that when they come in and take over, it has to feel safe for the person to to open up. So thank you. Okay, I see others. Teresa, go ahead.
My question is following up from Kim and just about that, the need for people to broadly have this information. And I'm just wondering, like, where are the other ways? Like, I think these were two wonderful sessions, and the resources from Crystal and everyone else are really amazing. But I'm wondering where else do we need to promote these sessions so that they're available to people? And I'm not sure who might have that answer, but I'm wondering, how broadly we can think to just make sure they're available. I don't know if Crystal has any other ideas of, it's that people don't search for this information until they absolutely need it. And then sometimes it's too late. But I just wonder if we just creatively think where else to post it. Is it in seniors associations, or I don't know. So nebulous question. But
Great question. Great. So Crystal, maybe I'll turn that to you for the
Yeah, I
answer
think
the
that's a great idea. Targeting highest risk populations. I think that's fantastic. So some of the corporations, the chains that own long-term care home facilities may be willing to share this information with their staff and residents and the families of the residents that live in their facilities. Even I'm thinking pharmacy chains, they like to share, usually it's print material, But maybe you could create some sort of like a postcard or something with links or links to these resources. We're certainly happy to put them on the Wounds Canada website under our webinar section, so they can be made available there. And we have sent information about these sessions out to our members. Colleges and universities. I mean, you can start right at the front with healthcare professionals, undergraduate programming. There isn't a lot of education on wound care, even less on wound prevention and pressure injury prevention. It's a great place. I'm sure they would be happy to receive free information, free educational resources. That's always helpful. Another group you may wish to target would maybe be the Skin Patient Alliance, the Canadian Skin Patient Alliance. They provide a lot of preventative resources to people with various, mostly dermatological, but also wound-related conditions. Those are just some ideas, some ideas. Yeah.
Great start. And of course, all the care settings. I mean,
yes,
you can get them out there, right? Andrea?
Yes, yeah. And I just saw Donna's note in the chat, and I'm sorry to hear your experience. And we're really trying hard to do that healthcare provider education. Currently, we have learning modules that we're working on for healthcare professionals in Alberta. They will only be accessible to the Alberta Health Services staff, though, because it would be a link that the staff log into. But I know that on the LPN website they even have learning modules that anyone can log on and access for healthcare professionals. So I know that a number of staff are looking at that, but yeah, we need to do more education and get that information out there.
Yeah, great, thank you. Donna, I see your hand up. Go ahead. Donna, no? We can't hear you if you're on mute.
Sorry. Unfortunately, this did happen in Alberta. So unfortunately, that staff member hadn't been educated, I guess, at that point, hadn't read your wonderful material. But going back to the question of, where can we present this? How can we make people more aware? I'm thinking that in my son-in-law's case, for example, if my daughter had been given information when he was admitted, things to watch out for. I mean, we talk about safety. I don't ever recall there being something on pressure injuries given to the loved one sitting at the bedside, so that they can help the staff to become aware and remind them, as I did, about, turning my son-in-law. Also home care, the home care nurses could be giving pamphlets or whatever, just like we do for fall prevention. We give home care clients the pamphlets on fall prevention. Is there something available for pressure injuries for families and patients at home? Because we pretty much know which people are at risk for pressure injuries. So in both those cases, in hospital, actually in nursing homes and home care, do we have any resources to give to the family?
And I'm going to piggyback on that, Donna. And when I'm thinking about our new thinking around patient safety that we're also promoting this week for Canadian Patient Safety Week, I also think maybe some of our resources, instead of targeting pressure injury, which is kind of that end point, maybe some of our resources could be skin care. And so it has more of a preventative before that alarming phase of having an injury, and taking more of a safety approach as opposed to a harm approach.
Yeah, absolutely. Thank you both. So Andrea, I think, there are some materials that are co-developed with patients, families, right?
Yeah, so we've been working on a poster that was put together by my colleague, has left. I saw her lovely smiling face on the participants before, but with a provincial patient group, and I can't remember their full name right now, as well as a clinician council, recommended having a poster so that when patients are in hospital, that they can see this information and know how to actively start preventing pressure injuries without even a staff member having to say something to them. And Crystal's also put some resources in the chat box too, and commented about the Care at Home series and DIY series of patient enablers as really good resources for at home. And yeah, they're free, as Crystal said, and I don't know if you wanted to comment any further about them.
So we're almost out of time.
Oh,
We
yes.
are out of time. I apologize for that. But I'm sort of conscientious that we just want to be on time. But I think there will be some things that will be shared. So you know, have a good look at the Wounds Canada sites. Connect with Crystal, you know, around this last question. Others. So if you have questions that we haven't quite answered, please share them with us by email or whatever, and we'll try to connect with you so you do have your answers. So I want to thank everyone. This is the end of this Pressure 2 session, Pressure Injuries Session 2. Thanks so much, everyone who has contacted and called us and joined and participated. It's been great. Again, we welcome any comments after this, but thanks so much for being with us. And thank you again, Andrea, for presenting, and all of the people who helped to make this possible. Take good care, everyone. Thank you.